Our convocation today is a little bit different than usual. We're going to have a panel discussion about addictions, and throughout the convo, if you scan this QR code or go to the link at the top, you can submit a question anonymously. I'll vet the questions, so not anything you type will get voiced, but if you have a question that you would like our panel to respond to, you can submit it there, and I can go through them and see which ones maybe haven't been talked about yet. There were 6 questions that were submitted ahead of time, so we're going to start with a few of those, largely because our panel got them in advance, but also to give you time to think about what questions you might have. I will also be roaming around with the microphone, so if you're in the auditorium and want to ask a question live, just raise your hand, I'll come over to you. By way of introduction, we have 3 panelists this morning. As Larry said, Liz Rimple was sick today, so she couldn't make it. But our panel includes Amy Voth-Siebert, professor of psychology here at Bethel. Yeah. Give it up for Amy. Professor Navante Peacock, also in the psychology department here at Bethel. And Jason Griever. Jason is an adjunct in the social work department here at Bethel, but is also the vice president of strategic development and clinical support at Mirror. Mirror is a local nonprofit and the largest provider of substance abuse treatment in Kansas. So Jason primarily teaches social work classes on addiction. So please welcome Jason as well. So if our panelists would grab the mic on whichever chair you feel like sitting at. Here's our QR code, and here are the questions we got in advance, but we're going to start with this kind of foundational question. What is the nature of addiction? And why do people get addicted to things in the first place? And if you feel comfortable diving in, whoever feels like they want to share first, dive in.
I'll go first, and I'll figure out how to work this microphone. So, first, I want to thank you for inviting me here today. This is really exciting, a great opportunity to come and share everyone. In Trent's introduction, one thing that I didn't include in that is that in addition to my work here at Bethel and my work with Mirror, I'm also a person in long-term recovery from substance use disorder, homelessness, trauma, and incarceration, and a lot of those other things that come along with addiction. And in some ways, at events like that, I feel like that's my greatest qualification, is having lived through and continuing to live through the recovery aspects of substance use disorders. So the question, what is the nature of addiction? And that is a great question, and when you talk to professionals, you get a lot of different answers on that. I think one of the most widely accepted answers is that it's a biopsychosocial spiritual condition. And so it has biological aspects where it impacts your brain and the neural pathways in your brain. It impacts the brain chemicals, specifically dopamine, which is the really great, feel-good, reinforcing, motivating chemical. It has psychological impacts. It influences the way that your brain thinks and how it perceives things. Socially, it has a lot of implications for how we socialize and with whom we socialize and with whom we don't socialize, how we perceive ourselves and how we're perceived by others, and then spiritual implications. So how someone with a substance use disorder perceives they fit into the world around them. And so addiction impacts all of those different domains in our lives. So that's kind of the nature of it. And why do we get addicted to things in the first place? Because they feel good. You don't hear people being addicted to things like slamming your finger in the car door or eating asparagus. People get addicted to things that are enjoyable. And they're enjoyable because we get a spike of dopamine whenever they occur. And dopamine is a great chemical to have in our brains. It's necessary for survival. It tells us when something is so good that we should keep doing it. And so when we eat, we'll get dopamine spikes. And when we have sex, we get dopamine spikes. And those things that are necessary for us to survive and for us to keep our species alive, our brains are hardwired to continue to do those things. And addiction plays off of that chemical. So when you think specifically about substance use, on an average day, like today, you're sitting in a convocation listening to some people talk, and you may or may not be super enthusiastic about where you are and what you're doing, but your brain is producing about 50 nanograms per deciliter of dopamine in your brain. Okay, so on a really, really great day, so you just finished finals and you aced all your finals, and honey baby boo boo just proposed to you, and so now you're getting married and you've got the perfect job that just got offered to you. Your brain may produce about 100 nanograms per deciliter of dopamine, and that feels really, really good. Now, if you use cannabis or marijuana, then your brain is going to produce about 780 nanograms per deciliter of dopamine. So it's going to feel a whole lot better than honey baby boo boo and the new job and all the A's on all the finals. If you use something, a stimulant like methamphetamine, then you're looking at 2,200 nanograms per deciliter of dopamine. So that's getting engaged to a whole bunch of honey baby boo-boos and getting a lot of really good jobs and being told you don't even have to take your finals. So if you can imagine how reinforcing that is, right? That feels great. And you have a sense of euphoria that says, hey, I feel so good, nothing could possibly go wrong right now. And so people are able to continue to use or to gamble or to watch pornography or stay on their cell phone because of that feeling of euphoria that nothing really bad can happen to me, even though bad things may be happening all around. Now, another thing about dopamine, and then I'll pass to everyone else up here, is that when you stop using substances, or you stop gambling, or you stop shopping, or you stop whatever compulsive behavior it is that is creating your addiction, your brain has been rewired. The neural pathways in your brains have been changed, and you're not producing the same amount of dopamine that you were previously. So in early recovery from an addiction, we talked about on a normal day like today, your brain's producing about 50 nanograms per deciliter of dopamine. Your early days of recovery, your brain's going to produce about 10 nanograms per deciliter of dopamine. And dopamine, we mentioned, is responsible also for motivation. And so on those early days of recovery, I don't feel like, and I didn't feel like, doing anything, like getting out of bed or interacting with the world around me. And so someone develops a very desperate feeling not to feel that way, right? And that euphoria is gone, and you start to see the consequences of everything that's been actually going on in your life, and you have no motivation to do anything to fix it. You can very easily get that 2,200 nanogram per deciliter of dopamine spike by using a substance. So that was a really long answer. I'll pass it on.
But such a vivid story answer. I think that that's so valuable. So the one other thing I'll add, hi everyone, is before I came back to teach here at Bethel is I was involved in public health in Colorado. And so I've come to this panel to just offer a couple of perspectives, not down at this sort of individual level, but at sort of a collective community level as well. And one of the major ways that I was interacting with the topic of addiction in public health spaces was either one, how do we reduce the harm of addiction through communication campaigns and other sort of like interventions at a community level to reduce it. And I worked with sort of the health consequences after disasters. And one of the things that we really noticed after big community crises was an increase in substance use, an increase in addictive behaviors, because people were so desperate to get out of that feeling of everything's screwed up. Nothing is the way that it was supposed to be before, and I don't know where to start. I have that desperate feeling of like, make this better. And yeah, to just reiterate what Jason has already said so well, I think one of the brain's primary organizing principles is to move toward what feels good, what gives us a reward, and away from what's causing us pain. And since that's the case, and since we had so many survivors who were just feeling pain, overwhelm with so many aspects of their life, what really came home to me in those experiences was that people start getting addicted to things for exactly the pattern that Jason already said, but often either because there's an opportunity to feel good in this really novel, really high intensity sort of way, and that intensity, that sensitivity to dopamine is particularly high when you're an adolescent or emerging adult, so like in that sort of age group. But two, when I have a chance to get away from something or to change the way that I'm feeling. And so I think one of the things we always were telling survivors is that what makes you feel good is a really reasonable coping mechanism when you have so much going on around you, but the consequence of that coping mechanism, especially over time, to your health, to your finances, are you spending all your money to get this thing that's making you feel better? Is that thing that's making you feel better also having bad impacts on your body? Like that's another issue in the brain, is that like when we are in that desperate state, when we are in a state of stress, we are stuck in the present moment. We're not thinking about the future. And so that's one of the reasons I can feel like the only choice now is to do this thing that makes me feel better.
Albert, would you click onto the next slide? My clicker's having a little bit of trouble. The online forum is blowing up, so I can guarantee you we're going to go until 11:50. But I also want to invite you to respect the questions that are being posed, because many students among you are asking really good questions. So maybe you can speak a little bit to this question, and then I'll give some from the forum. Are different addictions different, or are they all doing the same thing? Now, that seems like maybe that was already answered previously.
I can maybe talk about that a little bit more. Okay. So full disclosure, I'm probably the least qualified person on this panel, but I do have some knowledge from what the literature has to say about things. And so this question I looked up and found that for many different types of addictions, that you have your substance use sort of addictions, such as illicit drugs, but then the only real diagnosable behavioral addiction in the DSM-5 is gambling. But what they've shown is that those brain pathways, how your brain recircuits itself, as Jason mentioned earlier, actually look very similar from those gambling addictions versus substance use addictions. And so from that perspective, it seems like at least there tends to be an overlap between the different types of addiction and what it's doing to your brain. Yeah.
But yeah, socially, and like the factors, one of the other areas that I was really interested in is like, what's the point of decision making at which you encounter the thing that you are addicted to? And so in a bar, when you're drinking alcohol, you're out with friends, there's a more social element sometimes. People do drink alone, but like the types of addictions might differ by the other factors that are in the environment that enable them. One of the things that's so challenging and difficult about social media addiction is that we have no environmental barrier to it. It is with us all the time. We don't have to go somewhere to go find it. We don't have to, engage with somebody else in order to like do something on our phone, and we might in fact spend more time on our phone alone and without other people to sort of give us the feedback that, hey, you've been on that for hours now. And so we don't get that sort of feedback that might help us to sort of check just sort of the infinite scrolling nature, might help us to check sort of the fact that we have curated those dopamine hits for ourselves. Like our own algorithms are helping to perpetuate how much we want to stay on our phone, because we know that if we just scroll a little bit farther, we might get to that one handle that posts like the thing that we really enjoy, sort of like watching a quick video of, and then all of a sudden it's 3 o'clock in the morning and we've just been on our phone for the last 3 hours. So yes, brain pathways the same. The environmental factors of what you are addicted to do change depending on what the thing is that is drawing you in.
There are many variations of this question on the forum. What are strategies to overcome addiction? Or another way that it's been worded is, how do you break addictions?
Right, so I'll respond to that first, and there is no single pathway. There are many different pathways to recovery, and I think the key is finding out what works for you, and you do that by reaching out and inviting others in to learn about those different things. The evidence says that cognitive behavioral therapy is really effective. Motivational interviewing is really effective. Social supports like the AA programs and the NA programs and things like that are really helpful. There are all kinds of different ways that people overcome addiction. There's no one right way. It's finding what works best for you. And I'll pass it on, and then maybe we'll come back and talk about some strategies for phone addiction.
Yeah, I think something to keep in mind also is that there is a difference between excessive use and addiction, where excessive use is just someone who's doing something a bunch. So if you're on your phone a bunch, that's a little bit different than feeling compelled and feeling this sort of dependency on needing to be on your phone. So there is that slight of a difference to maybe make. Something that could be useful, there's some evidence for implementing these, they're called implementation intentions. It's essentially these if-then statements where if you see yourself in a certain situation, then you come up with a plan for what to do in that situation. So that could be, if you feel like you want to be on your phone, then what? And you create those beforehand so that when you find yourself in those situations, that you have a plan of attack so that you don't get back on your phone. So maybe that's if you feel like you need to be on your phone, maybe go for a walk or something similar like that.
To go back to the point of decision making, one, it is really hard for some addictions, including phones, to mark when you are starting, because we pick it up for maybe a more specific reason, and then we open an app and it just sort of rolls on. So point of decision making is, when am I starting, and how do I make checkpoints at those points of decision making to actually decide whether that's the action I want to intentionally take. Phones are really tough, but in and amongst other things, creating physical separation from your phone, maybe especially at night when you tend to doom scroll, like have a box on your desk that the phone goes into that is actually closed, rather than sleeping with it next to you. Maybe this is going to annoy your roommate, but if your alarm clock goes off over there and you actually have to get out of bed, that also stops the snooze alarm effect, and can actually benefit your sleep as well. We know now that our brain is so fine-tuned to our phones that it makes us sleep less deeply, and we get less of the benefits of sleep when our phone is close by. So creating physical separation is one part of it. Involving other people, I think isolation is one of the environmental effects that we know helps to sustain addiction, when other people give us an external perspective on our behaviors, that helps us to learn other pathways, other options that might not feel like they're available to us when we're stuck in that sort of now dopamine hit. I'm not thinking about my future activities, just what I'm experiencing currently.
I really appreciate your responses and how this is going. I'm also noticing that there are so many online questions that we're not going to be able to get through them all. Here's what I'd like to propose. We have a Convo Moodle page. I will put the questions up on the Moodle page anonymously with some responses, so if your question doesn't get answered today live, maybe we can get a response to it at least on the Moodle page. So I'm also going to prioritize questions that are live in the auditorium, and we have one at this point.
Okay, so this one kind of veers off of addiction, but I was kind of just wondering what your guys' opinions were on it. Our nursing cohort just did our mental health clinicals at St. Joe's ER because they have a separate area for mental health in their ER. And while I was there, I met a man that was 26 years old, and he was in meth-induced psychosis. So I was kind of just wondering what you guys thought about meth-induced psychosis and schizophrenia, and how you guys kind of differentiate the two in early stages of them, if you guys are, if you know anything about them.
Yeah, so one of the first things you do in making any sort of mental health diagnosis is rule out substance use, and so that's kind of the first step to differentiating that diagnosis is this person, has this person been using substances, and if so, that's where we're going to look first. If not, then we start to look at some of the other diagnoses that could involve psychosis.
Very limited knowledge on that, but yeah, the rule out factor is so critical, and there's so many what are called comorbid experiences, and again, because substances can be a means of coping with the overwhelm of a mental health experience, they can co-occur very often.
There's a set of questions online that are all kind of in the same theme, which is how do you differentiate when something becomes an addiction versus when it's just a habit or something that you do regularly?
So that's an excellent question. And it used to be that in the book that we use to diagnose things, the DSM, there were two classifications for substance use disorders. There was a substance abuse disorder and a substance dependence disorder. And we moved away from that for some very good reasons, including the term abuse. One of the things that I think is so important and so powerful is the language that we use. And when we talk about abuse, usually we're talking about abuse that's perpetrated against another person. And so if I'm an abuser, then I'm a spousal abuser, or I'm a child abuser, or I'm a sexual abuser. And so then to call someone a drug abuser has some connotations to it that are a little bit stigmatizing. And so that's part of the reason for moving away from terms like substance abuse. But we also realize that substance use disorders are on a continuum, right? So there are 11 criteria for a substance use disorder. If you meet two of them, or if you meet 2 or 3 of them, then you're considered to have a mild substance use disorder. If you meet 3 or 4, then it's a moderate substance use disorder. 5 or more, it's considered a severe substance use disorder, and that's when we really will call it an addiction.
Yeah, I was trained on DSM-4, so I will say that I am out of date, but I think I really did appreciate sort of the language of recognizing that something becomes a disorder when it impacts your ability to function. And sometimes, again, you get that feedback from other people. Sometimes you recognize it in yourself. And the other big factor is it causes you distress. When you feel like you're out of control with it, Like at any point that you want support, maybe this is the message I really want to give. At any point that you want support, get support. And when, again, it becomes, when the thing that you are addicted to causes difficulty in doing the other activities of daily life that are essential to you or that you care about, then maybe it's time to pay attention.
Possibly also what happens if you try to stop. If you are able to stop and things are relatively fine, then that's probably less likely to be an addiction. But if you stop and you have those compulsions still and you feel that need to go back, then maybe that's also another way to tell.
I'm real curious, real quick. I'd like to ask a question of the folks who are here. How many folks in here, either personally or through a family member or a friend or someone that you know and care about, have had exposure to addiction? So that's most people. Most people either have their own struggles with addiction or know of someone close to them who has. So thank you guys for sharing that. I'm a good audience then.
Yeah. I want to pause if there's anybody that has a question. Yeah.
I'm trying to figure out how to phrase it, but like obviously environmental factors would make some people more susceptible to addiction than others. Are there genetic factors too that make people prone to addiction? And then also, are there some people who like, I don't know how to, like, they're genuinely like they are non-susceptible to addiction? Like, are there people who can just go cold turkey on things, or like they can do drugs and it won't rewire them? Or is that recorded?
So some great questions there. So you'd mentioned some environmental risk factors there. There are lots of different types of risk factors. Genetics are absolutely one of them. If you come from a family in which substance use is more prevalent and substance use disorders are more prevalent, then you have an increased risk of developing a substance use disorder. And it could be because the substance use is normalized. It could be because you have greater access to the substances. Lots of reasons why that could be true, but yeah, a lot of risk factors. Some health conditions can make you more susceptible to developing an addiction. Where you live, what your income is, what the color of your skin is, what your gender is. All of those things can increase risks for developing substance use disorders. Now, there are absolutely some people, and it blows my mind, who will use in ways like I used to use, and one day they'll decide they're going to stop. And they stop. And it's amazing to me because I can't fathom that. So I don't necessarily know that they're completely immune to addiction, but there are absolutely people who can just stop, and then there are some people who never use substances or engage in behaviors like gambling that really become risky for developing an addiction.
Yeah, I think one of the articles I read said something about genes can explain up to almost half of addiction. Personality can play a role, stress, environmental factors, things like that. Something that I will say is, though, that idea of people who are addicted just don't have enough willpower is not necessarily what's happening, though, just to be clear. But there are some things about the person, as Jason just mentioned, that can absolutely put someone more at risk.
So I was going to ask what Moses asked, but I have another one. So with a lot of things like gambling specifically, there's this kind of problem with like the commodification of it showing up everywhere. You know, if you have a heroin addiction, you're a lot less likely to see advertisements for heroin on every billboard, or if you try to go to the park with your kids, seeing people screaming at you about it. But there is kind of that problem specifically with gambling addictions, where it's showing up on sports games in the middle of them, you know, if you want to enjoy the thing without it, or it's showing up on your phone, it's showing up on YouTube advertisements, and in pretty much any way you try to engage with the world. similarly, you know, your phone is kind of at this point setting you up for that because there is a monetary incentive for these groups to do this kind of thing. So how do you try to deal with those kinds of things in a, I'm going to say, capitalistic, very profit-driven society?
I mean, I think even naming that is an important, like, I recognize that somebody has a vested interest in getting me hooked on this. We don't like when people take away our free will, and it's maybe a little bit more of a response to that when it's a person versus when it's a thing. So naming that is a great thing. Do you know that it used to be that you could advertise cigarettes on children's television? We don't do that anymore. So there are societal measures and societal policies and rules that have come about because of what we've been learning about addiction. I think that online gambling is a new frontier in which we need sort of social will to change the practices in similar ways. Just one thing, I know like that this is like a required thing to even get on the app to begin with, but don't give the app your financial information because once again, that removes a checkpoint in the point of decision making that like, it's already got my information so I can just press a button. If I had to re-enter my financial information every time I was about to make a bet, I would have to sit and think about it a little bit more. So that is an action, that is a practice that you can put in front of yourself to stop things more readily if you're concerned about that.
I have a question because I feel like there's a lot of stigma around addiction in terms, like just like what you said earlier about people assume that you just have to have enough willpower to shake an addiction. And I guess my question is, how does one go about helping someone in an addiction, and also how do we reduce that stigma and create not a sense of weakness, but like a strong foundation for people to shake an addiction or break an addiction?
Motivational interviewing is such an incredible skill set that you can use even if you're not a professional. Highly recommend just sort of looking at it, but it really means meeting the person where they're at and helping, in a very sort of like humanizing way, check in with what's true about their life right now and what they would like their life to be, and use their own sort of like interest in seeing a change as sort of the motion setting for that. Sorry, that immediately came to mind, and I maybe should have thought that answer out a little bit more, but I think that there are skills that all of us can build as just friends and classmates and people who encounter others, where we can meet them as individuals. And I think part of what stigmatizes somebody is when you start to label somebody as, like lazy or lack of will, or like you take away the human part of it and don't meet them where they're at and sort of find their own internal reasons to want to change.
Sorry. Gosh, so part of why it's so stigmatizing is because there's the perception of control in the behaviors. And so when we think that people have the control of what they're doing and they're doing something that is perceived negatively, such as engaging in their addiction, then it's easy for people to become upset with that person after one or more interventions of trying to get them to stop. But I think approaching the situation with more empathy and trying to meet them where they are can be helpful, because if you approach it with anger or just like disappointment or negative emotions, then it can lead to more negative emotions for that person, such as shame and guilt, which can lead to them maybe not wanting to open up to you anymore or hiding the behaviors even more, which isn't necessarily going to be helpful.
Wanting to avoid the negative experience of talking to you.
Johannes Hari says that the opposite of addiction is not abstinence, the opposite of addiction is connection. And I don't know that I 100% agree with that, but I think it raises a really important point that for a long time what we did was we said we're either going to cut people off and until they get it figured out, we're going to practice tough love. And what that has led to is isolation of people and to people forming relationships that are not in their best interest. So as far as what you do to help people, you help them in a way that honors yourself and that keeps yourself safe emotionally and spiritually and in all aspects. But you don't withhold love. I think it is the biggest thing. And then you asked about stigma, and I could talk about that for days and days. But you look at the history of addiction, and have you ever heard the term Alcoholics Anonymous? Yeah, why did we call it Alcoholics Anonymous? Because we didn't go tell people we were alcoholics because it was so stigmatized, and it still is. I'll tell you, when I entered the field 15 years ago, I would not have sat up here and told you I'm a person with lived experience because it was so stigmatizing that if I would have said that, then people in this room would have looked at me a certain way, and some people would stop listening to me because I said that. Fortunately, that's gotten better, and so now I can sit before you, and I can say I'm a person with lived experience, and we know enough now about not just substance use, but other types of disorders and conditions and people who live through different things, that it doesn't necessarily mean that I'm a bad person because I've had that experience or lived through that experience, but I might have insights from that. Yeah. Anytime you want to talk about addiction stigma, let me know. We can talk about it all day.
Hi, so you mentioned dopamine's role in motivation earlier. I was wondering if you learn about a clear distinction between motivation and discipline, because to me, discipline is doing something even though you don't want to do it, like getting out of bed in the morning. Is there any way we can learn to be more disciplined or do the things to be more reliably productive?
I suppose I'll address a question that's related to that. And that's where, when you become addicted, your things that are going on in your frontal lobe that allow you to make decisions and make sound judgment and think rationally, when you have an addicted sort of brain and those routes are rewired, your executive functioning, those decision-making skills become lessened. And so when you are addicted to something, then your ability to do those things is lessened. So that's not exactly answering your question, but related.
I would add that discipline is a huge part of recovery. And discipline involves, or the discipline in recovery involves not going to certain places or being around certain people. It involves not doing certain things. It involves doing certain things. I have to do the things that promote my recovery. And for some people, that means I have to go to those AA meetings or those NA meetings, and I have to call my sponsor, and I have to do those things. For some people, I have to talk to my family regularly, or I have to go to the gym regularly, or I have to go to church regularly, or whatever it is. But there's a whole lot of discipline that's involved in recovery and disciplining yourself to engage in things that are going to promote recovery and decrease risks of relapse.
Yeah. Addiction, there are multiple facets of addiction, but one of them is that it's habitual behavior. And habits can be unconscious. They are certainly more automatic. And so it requires a lot of discipline to not just remove one behavior, but to insert and replace different behaviors with what was happening automatically. And that is hard because it, like, especially when you're learning a new pathway, it requires more attention, it requires more cognitive load, it requires more regularity and use literally of energy to focus on that than how easy it was to do the thing that you got in the habit of doing. So yeah, there's a strong relationship there.
That's probably all the time we have for this session, but yeah, let's give our panelists applause. Thank you both so much. I'll note, if you have been inspired